Ever wondered what causes bad breath, also known as halitosis? Well, if you've ever been curious about the science behind bad breath, you're in the right place. Halitosis is the term used to describe an unpleasant or offensive odor emanating from the mouth. The causes of halitosis are numerous and varied, ranging from the foods we eat to systemic conditions within the body. But not all bad breath is created equal. There's a distinction to be made between physiological and pathological causes of halitosis. Physiological halitosis refers to bad breath that's a normal part of our body's functioning, like morning breath. Pathological halitosis, on the other hand, is a symptom of an underlying health condition or disease. So join us as we delve into the world of halitosis, exploring its causes, its effects, and most importantly, what we can do about it. If you've ever been curious about the science behind bad breath, you're in the right place. Bad breath can be a temporary nuisance or a long-term problem. Let's dive into the world of halitosis, where we distinguish between transient and chronic types. Transient halitosis is like that uninvited party guest who shows up but luckily leaves quickly. It's often due to factors like certain foods, dehydration, or poor oral hygiene, and thankfully it's usually short-lived. On the other hand, chronic halitosis is like the unwanted house guest who just won't leave. It persists over time and might be an indicator of more serious health issues, such as respiratory, gastrointestinal, or metabolic disorders. In the realm of halitosis, two terms you'll come across are genuine and pseudo. Genuine halitosis is real, measurable bad breath, while pseudo-halitosis is when someone perceives they have bad breath but there's no detectable odor. So remember, not all bad breath is created equal. Our mouth is home to hundreds of bacteria, but did you know they play a crucial role in maintaining oral health? This microscopic community, also known as oral flora, is typically in a state of balance. When in harmony, they help fend off harmful germs and aid in digestion. However, when this balance is disturbed, it can lead to various oral health issues, including halitosis, or bad breath. Changes in oral flora can occur due to various factors such as diet, medication, and lifestyle habits. For instance, the consumption of certain foods like garlic and onions can alter the bacterial balance, contributing to temporary bad breath. Similarly, poor oral hygiene can allow certain bacteria to multiply, which may result in a persistent foul smell. So, it's not just about brushing and flossing, but also maintaining a healthy oral flora to keep your breath fresh and pleasant. The balance of bacteria in our mouths is more important than you might think. What we eat, how we hydrate, and how well we clean our teeth can all affect our breath. Now, let's delve into these factors a bit more. Food consumption plays a significant role in the quality of our breath. Foods with strong odors like garlic and onions are notorious for causing temporary bad breath. But it's not just the smell of the food itself. As these foods get broken down in your body, they enter your bloodstream, travel to your lungs, and affect your breath. Dehydration is another contributor to halitosis. A dry mouth is a breeding ground for bacteria. Our saliva serves a crucial function in maintaining oral health by washing away food particles and bacteria. When we're dehydrated, saliva production decreases and bacteria can multiply, leading to bad breath. Regular intake of water not only keeps you hydrated but also helps to rinse out your mouth and prevent bad breath. Poor oral hygiene is perhaps the most direct cause of bad breath. Neglecting to brush or floss your teeth regularly allows food particles to accumulate between your teeth, around your gums, and on your tongue. These particles can decay and lead to an unpleasant odor. Bacteria thrive on this decay and emit volatile sulfur compounds, which are primarily responsible for that foul smell. So how can we combat these factors? By maintaining good oral health habits. Brush your teeth at least twice a day, and don't forget to floss. Regular flossing removes the hidden food particles and plaque that your toothbrush can't reach. Cleaning your tongue, either with your toothbrush or a tongue scraper, can also help reduce bad breath. Regular dental checkups are also essential, as your dentist can detect and treat oral health problems that may lead to bad breath. Remember, a healthy mouth is the first step towards fresh breath. By paying attention to what you eat, staying hydrated, and maintaining good oral hygiene, you can help prevent halitosis. So, maintaining good oral hygiene is key to keeping halitosis at bay. Sometimes the cause of bad breath is more than just what's in your mouth. While it's true that factors like food consumption and poor oral hygiene can contribute to temporary bad breath, there are also systemic conditions that can lead to chronic halitosis. Let's delve deeper into this. Respiratory conditions such as sinusitis, bronchitis, and pneumonia can cause halitosis. These conditions often lead to postnasal drip, a situation where excess mucus trickles down the back of the throat, creating a fertile breeding ground for bacteria, which in turn can lead to bad breath. Similarly, gastrointestinal disorders also play a role. Conditions such as gastroesophageal reflux disease or GERD can cause stomach acids to flow back into the mouth, resulting in a bitter taste and foul breath. Diseases like peptic ulcers, which are caused by H. pylori bacteria, can also contribute to bad breath. Moving on to metabolic disorders, diabetes is a prime example. When the body cannot effectively use glucose for energy and resorts to burning fats instead, it results in the production of ketones. High levels of ketones can lead to a particular type of bad breath known as keto breath, which is often described as fruity or sweet. Now, let's talk about medications. Certain drugs can cause dry mouth as a side effect. Saliva plays a crucial role in maintaining oral health, including keeping bad breath at bay. It helps to wash away food particles and bacteria and neutralize acids produced by plaque. When the production of saliva is reduced, it can lead to dry mouth, creating an environment where bacteria thrive, leading to bad breath. In conclusion, it's important to remember that while bad breath can be embarrassing, it can also be a sign of underlying health conditions. It's always best to consult with a healthcare professional if you're experiencing persistent bad breath, as it could be an indicator of something more serious. As you can see, halitosis can be an indicator of more serious health issues. So, how do doctors and dentists diagnose halitosis? The process is comprehensive and it begins with understanding the patient's history. This includes their dietary habits, oral hygiene practices, and any underlying health conditions or medication use. Next comes the clinical examination. Here, the medical professional visually inspects the patient's mouth, checking for signs of dental diseases, dry mouth, or any other abnormalities that might contribute to bad breath. But the diagnosis doesn't stop there. It's followed by breath analysis, which is an objective assessment of the odor of the breath. This is achieved using tools like portable sulfide monitors. These devices measure the concentration of volatile sulfur compounds, the gases primarily responsible for bad breath. In some cases, a more detailed analysis might be needed. That's when gas chromatography comes into play. This technique allows for the separation and identification of individual compounds in the breath, providing a more in-depth understanding of the issue. With the right tools and information, diagnosing halitosis can be straightforward. Now that we know what causes halitosis, how do we treat it? The management of bad breath largely depends on its underlying cause. If the cause is transient or due to dietary choices, simple adjustments like drinking more water, reducing the intake of odor-causing foods, or using mouth rinses can be effective. However, chronic halitosis often requires a more comprehensive approach. Poor oral hygiene is one of the most common causes of chronic bad breath. In such cases, regular and thorough brushing and flossing are crucial. It's also important to clean your tongue, as it can harbor bacteria that produce foul-smelling compounds. Remember, your mouth is home to hundreds of different types of bacteria that play a key role in maintaining oral health. Disrupting this balance can lead to a variety of problems, including bad breath. So, while it's important to keep your mouth clean, you don't want to go overboard and eliminate all bacteria, as some are beneficial. Regular dental checkups are another essential part of managing halitosis. Your dentist can help identify any potential issues, such as gum disease or tooth decay, that could be contributing to your bad breath. They can also provide professional cleaning to remove any plaque or tartar buildup that you may have missed during your routine cleaning. Now, if you've addressed your oral hygiene and still struggle with halitosis, it's possible that a systemic condition could be the culprit. Conditions like respiratory or gastrointestinal diseases or metabolic disorders can all lead to halitosis. In these cases, managing the underlying health issue is key to treating the bad breath. Lastly, certain medications can cause dry mouth, which can subsequently lead to bad breath. If you suspect your medication is causing your halitosis, it may be worth discussing alternative treatments with your doctor. In most cases, managing halitosis is all about maintaining good oral hygiene and addressing any underlying health issues. So, keep up with your oral hygiene practices, make regular visits to your dentist, and stay aware of your overall health. These simple steps can go a long way in preventing and managing halitosis.